Imagine living 60, 80, 90 years of quality health. What's the key word? It's quality. And imagine living that type of life where you're not dependent on drugs and surgery or medication just to function and get through your day. And imagine living and having predictable health and a predictable life. That means that you know what you can be doing 10, 20, 30 years from now. You have the vitality to do it. You have the energy to do it. You know you have the autonomy and freedom to do the things you want to do and live life on your terms. Now, the three questions you must answer by the end of the day is number one, do you believe it's possible to live that type of life? Absolutely. Thousands of people are doing that. Number two, though, the way your health is going, the issues that you're currently having, and you know they will continue to go that way, do you have the confidence and do you feel that your body is capable of living that type of life? And the third question is, do you believe you're worthy of living that type of life? Hi, I'm Chris. I'll be your host today, and I'm with Renew Life Rejuvenation, and we specialize in regenerative medicine. So to let you know the agenda, we're going to talk about an introduction to Renew Life Rejuvenation, how we have helped thousands of people with your very same condition, if you are a candidate, had amazing life-changing results and living life on their terms. We're going to talk about your symptoms and your current options in healthcare today. You know, your symptoms could be the joint pain, the osteoarthritis, the neuropathies, you know, the pain in the knees, the hips, the shoulders, all those joint pains, spinal pain. We'll go over all those, tell you exactly how we'll be able to help people. And then the options today. A lot of times your only options are drugs and surgery or even pain management. We'll show you alternative methods that are very, very successful, allowing your body to heal itself. Then we will talk about regenerative medicine. I will not be going over the being a cheerleader, basically. We're going to go over the good, the bad, and the ugly. We must know all of the information to make that informed and correct decision to get the best results, what is different, how we do it differently. And at the end of this, if you feel that this is a great fit for you, we'll move forward with the consultation, and then we could see if you're going to be accepted and a candidate for this type of treatment. So our medical team in Texas, Dr. Charlotte Johnson is the overseeing medical site doctor. V Tran, she's just an amazing nurse practitioner. In Texas, all the procedures are done and performed by the nurse practitioner. We also work with Dr. David Martino. He's a world-renowned doctor, works with athletes, and his education and his expertise in regenerative medicine and neuropathy for our neuropathy patients. So my first question to you is this: what has your pain cost you? Now, I don't just mean the monetary value, but we can put it, right? I'm sure how many thousands of dollars have you spent due to loss of time or not able to be as productive as you could be, or, you know, the times that you couldn't even pay to get back, or on rehab or chiropractic or massage or acupuncture or drugs and all these other things. So yes, we could put a tremendous monetary value of tens of thousands of dollars, but not to limit and not to just kind of downplay the monetary value. What's even more important, and we believe what's more important, is your opportunity cost. What can you no longer do due to your pain and your conditions? That is your opportunity cost. What is one thing, think to yourself, what is just one thing you wish you could get back and be able to do again if it wasn't for the issues you're having now? I'm going to show you how we've been able to help thousands of people get back to doing things that they love and live a life on their terms. Now, next question is, what is our most precious commodity? Now, health, especially in this time right now, health is our greatest asset, right? Especially now. But a commodity is something that's tradable. And there's two things that you could trade that you need to make a decision today. You could trade your time or you could trade your money. So what's your most important commodity? It's your time, because you could always make more money, but can you make more time? No. Once that time is lost, it's lost forever. So quality of life is really two components. In order to have quality of life, you need to have your health plus time. That equals quality of life. Many experts agree that our healthcare system is broken. Have you felt that? Well, let me just show you. In the US, we make up only 5% of the world's population. We take 75% of all the world's medication. We take 80% of the painkillers with 259 million prescriptions each year, to show you that people are being told to mask the problem. And we're ranked 37 out of 37 when it comes to health in the top 37 industrialized nations. Now, this is the usual thing you're used to. This is an insurance-driven healthcare system today. So you have Dr. Jones in the middle. Dr. Jones is a great doctor. We love him or her. They're wonderful, but they work their life off to be able to help people and save people and be heroes. But when they started working in the healthcare field, they realized they work in an insurance-driven healthcare system. And due to the insurance companies and policies, they are handcuffed to what they can and what they are able to tell you to do due to what insurance will or will not pay for. So they're handcuffed. So you go to Dr. Jones, and the protocol is this. What's Dr. Jones give you? No matter what the symptom, he's going to give you a drug, right? Now, does that drug get to the root cause of the problem? Absolutely not. It masks it. It's like taking batteries out of the fire alarm. Now, when that doesn't work, every single day is your problem getting better or worse. It will always get worse if you never get to the root cause of the problem. So one drug leads to what? You know the story, more drugs. Do those drugs have side effects? Yes. You may even take drugs for the side effects. Are they healthy for you? No, they're masking symptoms. Now, as your problem continues to get worse, the drugs are not effective, they're not working. Now you're a candidate for what? Surgery. The issues with surgeries with the conditions you're having is this. Just knee patients alone, 52% of knee surgeries need a revision within the first year, 76% within the first 5 years. If it deals with spinal orthopedic surgery, it's even higher. So you do one surgery, and when that surgery doesn't take, it usually needs to what? Other surgeries. So now you have all these other surgeries, they're coming with complications, risks, and you wind up having different symptoms like scar tissue from surgery complications as well. So years could go by, you did the drugs, you did the surgery on them, not getting better. Then the final place they'll take you is in the top left. It's called pain management for life. Pain management is when you're giving very harmful, addicting Schedule II medications and opioids to totally numb you out, destroy the pain receptors of your body, and you're not even a person anymore. You're really in a prison, and that's the only options people are given. And you take that for when? For life. When does pain management expire? When you do. So you can see this system, if you continue to do this system over and over again, you cannot be frustrated when you don't get the results you want. So we're here to tell you a much better alternative system that works not, see this, what you're looking at here, it masks the symptom and it works from the outside in. We're going to show you another system now that works with your body's own healing capabilities. We look to the cause of the problem, not mask it, and we work using your body's healing potential. So the one we'll talk about today is regenerative medicine. And the top pillar of regenerative medicine we'll talk about, one of the pillars, is stem cells. Now, what is a stem cell? A stem cell is a cell that could replicate itself. We started with 2 stem cells, mommy and daddy, and in 9 months, we're 70 trillion cells. And notice your cells are all your tissues, there's different tissues in your body. So yes, stem cells replicate themselves, but they also do what? They turn into other tissues. They differentiate and regenerate tissues. Stem cells have been proven to regenerate nerve tissue. So if you have nerve pain or neuropathy or nerves that are like on edge, what would that mean to you if it could regenerate that? They regenerate capillaries that deliver blood flow needed for healing. So to the joints and the rest of the body. So if you had like a neuropathy or erectile dysfunction or other blood flow diseases, what would that mean to you if those capillaries and blood flow could regenerate itself? Then most of the people are here because of what? It regenerates cartilage, ligaments, and tendons and bone, everything joint. If it could just regenerate and restore those tissues for the joint pain you're having, what would that mean to you, your quality of life, and living life on your terms? Now, when it comes to the regeneration process, stem cells, the regeneration takes place, remember this, between 3 months and 9 months. That's when the magic, so to speak, happens of regeneration. But those stem cells are still replicating your body for up to 3 years. So what is a stem cell? Again, it controls inflammation. So it cools down the inflammation you're going through. It modulates your immune system. Inflammation is an immune system response. It stimulates regeneration. It doesn't just mask it, it's literally fixing the problem. And I want you to think stem cells are your internal healing mechanisms. They're your little worker bees that are doing its job in the body at all times. The more you have and the more powerful they are, then your body could heal and regenerate as you were looking for. But pay very close attention now. And your doctor, you got to be very specific on this. Many chronic diseases that you're having right now are due to a lack of or dysfunction, let me say it first, of mesenchymal stem cells. Say that with me. Mesenchymal stem cells. This is the only stem cell studied and proven in research to regenerate the tissues and the conditions that you're having around now. The mesenchymal stem cells. There are other stem cells out there. That's why you got to be careful. It must be the mesenchymal stem cells. Now, as we age, the number and function of our stem cells does what? It declines. And I think you've all experienced it, right? You don't heal as effectively as you used to. So what does mesenchymal stem cells do again? These are the MSCs. They are multipotent cells, and they are found in your bone marrow. The FDA only recognizes stem cells from your bone marrow. So they are in your bone marrow. And then these MSCs, they're important for making and repairing skeletal tissue, the joints, the cartilage, the meniscus, the tendons, the ligaments. They are anti-inflammatory, they modulate your immune system, and they stimulate repair. These are the ones that actually get your body from healing from the inside out. Now, a couple great places. Look at this. The Mayo Clinic, the top clinic in America, they say that stem cells and derived products offer great promise for new medical treatments. The Mayo Clinic is using the technology we were talking to you about today. Time Magazine even stated that new research suggests that perhaps we should consider stem cells one of the secrets to a longer life. They did not say more drugs. They did not say more surgery, because medicine knows today masking symptoms, cutting out organs and joints, it's not the answer. It's masking it. Where now science is looking to getting your body to heal from the inside out by actually correcting the cause and the root cause of your problem. So when it comes to stem cells, I want to let you know what we do not use. This is the good, the bad, and the ugly. We do not use embryonic stem cells. They're from embryos. They're from aborted fetal tissue. They're surrounded in controversy, and they're absolutely not legal in the US. This is why we only recommend, and we tell people, only do regenerative medicine within the United States. Outside of our country, yes, it's cheaper, but you do not know what you're going to get. It's not regulated. We do not use adipose-derived stem cells. These are when it's taken from your body fat cells. It's absolutely extremely painful. It's a limited amount of cells that you can even harvest, and these cells are less fit. They are weaker. They do not carry the potential that will show you that's possible for you to heal. Now, what we don't use, again, is these untested vials of magic juice. There's a lot of times you got to make sure these products are regulated, and they're through the lab. The FDA has approved them. A lot of times there's these magic serums out there. People try to tell you, listen, do not do anything magic. It's very painful on your wallet. It may or might not contain what they say because it's not regulated. And companies like Livion, you'll see bad press about them when it comes to regen meds. So you want to stay away from those. Now, what we do use, very importantly, we choose to use bone marrow. Again, the FDA states stem cells can be considered stem cells if they're from your bone marrow. It's called autologous. It's coming from you. It's a simple 10-minute procedure to remove the bone marrow or get what we need from there. There's a high volume. The high volume of bone marrow is easy to access in your hip, your iliac crest. And this is great, guys. Watch this. No issues with tissue matching. Why? It's coming from you. It's a perfect match, a very, very perfect match. This is why we choose bone marrow. This is how we aspirate the bone marrow. How do we get it from? We have a tool right there, and don't get scared of this. You see this big old needle. It's a very thin, it's a procedure done. It doesn't hurt at all. You go in there, and it's a little bit of poke right in there. We get through the skin and bone, and we could get right into that bone marrow, right at the iliac crest. You'll see it's at the hip, the top lateral part of your hip, and it's in and out, and we could just pull out the bone marrow right there, the stem cells, and then actually be able to use it and put it into whatever joint or condition you're having if you pass as a candidate. Now, here's something I want to go over with. Now, we're talking about getting stem cells from your bone marrow. Now, when you look at this chart right here, you could see in a newborn, as we could say, as we age, read it at the top, as we age, our body's ability to regenerate damaged tissue does what? It decreases. Do you heal as quickly as you did when you were 5 or 6? Absolutely not. You know, a 5 or 6-year-old, they cut themselves, 2 days, beautiful new tissue, not even a scar. This is because the fitness of your stem cells in your body begins to diminish over time. So I'll talk about what fitness is. So on the left, you'll see in a newborn, for every 10,000 cells of a newborn, there's one mesenchymal stem cell. And as you get older, look, at 50, it's only 1 out of 400,000. At 70, it's 1 out of 2 million. So you can see as we age, the potency of the stem cells go down in our body. Therefore, you're not regenerating as quickly. And now the fitness or the ability to replicate the stem cells goes down. For instance, in that 70-year-old, let's say you took that one mesenchymal stem cell, and let's say you took the one mesenchymal stem cell of the newborn. That 70-year-old, in 30 days, that one turns into 200 mesenchymal stem cells. That newborn, that younger, more powerful cell, in 30 days turns into over 1 billion stem cells. How about that, right? So the younger cell is more powerful. It has more fitness. It regenerates more. So this is the key, and this is the key difference that we're able to use and we've been utilizing that has been gained just amazing results with our patients is because using the bone marrow is great. It's getting it from your stem cells and it helps so many people. But we found a way to take the age out of it because now your age is the variable. But what if we were to put those younger on the left? If we took those younger, more powerful stem cells or product and we were able to put those into a 50, 70, 90-year-old, now is age a variable? No, because we're putting the younger, more powerful cells and growth factors in the body. So what we have done is we actually use your bone marrow, and this is kind of the secret. This is the secret that we do that we're getting results where other clinics fail to get, is we take your bone marrow and on the side, in conjunction with it, in addition to, or even separately, we also add younger growth factors from the younger, more powerful cells. So we're doing your bone marrow, all right, alongside something we call umbilical tissue, the umbilical cord tissue. And I'll show you that right here. So now alongside your bone marrow, we actually use umbilical cord tissue. It's called Wharton's jelly. Now, this is the umbilical cord. It's not the baby and it's not mom. It's healthy mom, healthy baby. The lab gets them immediately. They're screened for endotoxins, diseases, and our lab meets and they always exceed the FDA guidelines and regulations. So it's beautiful umbilical cord. It has those younger, more powerful cells. It contains cytokines. These are the growth factors that are going to help boost, alongside separately with the bone marrow. Cytokines, they cool down inflammation. HA, hyaluronic acid, lubricates the tissue and joint. They have growth factors that help build the scaffolding to help the bone marrow, your stem cell in the bone marrow work at an even higher level. And this is, of course, FDA cleared labs, and there's zero reactions because the Wharton's jelly has no biological markers for mom or baby. So again, there's no chance of reaction whatsoever. So here's the key. This slide I consider the secret slide. This is the secret sauce of what we do, is that some companies just use bone marrow. Some companies just use the umbilical cord tissue, but they're both missing the boat. This is the advantages to cord tissue allografts, the umbilical cord tissue, plus your bone marrow. Number one, you're getting the younger the cell, the more powerful the cell. So you're getting that from the umbilical cord tissue. Alongside of that, you're going to get the cells will not be rejected from your body because it's you, and there's no biological markers. And number three, this is it. You get the mesenchymal stem cells from the bone marrow, and now you're getting the potent growth factors from the allograft or the umbilical cord tissue. This is the key. This is the 1-2 punch that's going to get you fantastic results. Again, if you're a candidate, we have to make sure that you're a candidate. So with those, using those two alongside each other, these are the orthopedic conditions that if you're a candidate, we have had amazing, or people had amazing, thousands of people got amazing success with, such as meniscus repair in the knee, ligament repair in any one of your joints or tissues, cartilage repair, tendonitis or tendinopathy, rotator cuff repairs, your joints such as your knees, your hips, your spine, your whole spine, your shoulders, your elbow. If we didn't mention your joint, we ran out of space. We've done plenty of ankles and wrists and gouty toes and trigger fingers and RA fingers and osteoarthritic fingers. Any joint, this will be able to have success in if you are a candidate from the examination. Now, if you have your problem for a long time, you've been told you have osteoarthritis, and you would know. If you're watching this, you already know because you've been told you've had degenerative joint disease or degenerative disc disease, or may have been told you have stenosis in the spine, very, very painful. Or you have fractures, treatment of fractures, bone loss due to avulsion fractures from maybe an underlying osteoporosis. Now, most all procedures are done specifically ultrasound guided or fluoroscopy guided into the joint specifically. But if you have osteoporosis or osteopenia or a history of that, ask your case manager. You may be a candidate for a whole body stem cell infusion. That's where we extract the stem cells and we do it intramuscularly. So we flood your entire body because you can't put in each bone. So we flood the body and the bone density goes through the roof. So again, if that's the case, if you do have osteoporosis or osteopenia, make sure you tell your case manager that. And this will also help if a candidate all arthritis in all of the joints. Now, this is the typical office visit. You came into our clinic, right? You're in one of our clinic. You're going to now meet with one of our case managers. Now, our case manager will sit down with you, knee to knee, face to face. They will learn more about your case and what's going on with you than any other office. We guarantee that. We really got to understand what's going on with you to help you get and reach life and live life on your terms. That case manager, they will then determine if we could accept you as a patient. We do not accept anyone as a patient because we want happy patients. And the only way you're going to be a happy patient is if you get what? If you get results. So accepting you really is putting our reputation on the line and your reputation and your results on the line. We want to make sure that we accept you for that. Now, once you're accepted as a patient, then we got to understand, are you qualified for the treatment? Can you be able to get this treatment? The only way we know if you're qualified is what? Doing our examinations. So we will either be reviewing your CT or MRIs or reviewing your x-rays, taking certain x-rays and pictures that we need to be able to examine. The medical team and lab will meet together. They will then determine if you're a candidate or not. If you are a candidate, we choose to work with you and you choose to work with us. Then possibly in the same day or maybe a day very shortly after that, we will set you out. You will actually then get the procedure where we extract the bone marrow or the stem cells from the bone marrow. And then after the bone marrow, that they will be re-injected, your stem cells, the mesenchymal stem cells, and alongside or separately as well, the umbilical cord tissue will be injected using an ultrasound guided injection or fluoroscopy. Please let me slow down and tell you this. It has to be ultrasound guided because you will actually see it. For some of you, there's so little tissue left in your body, so little tissue between the joint that it is impossible for someone to just poke around and feel. It has to be ultrasound guided so you could specifically see perfectly exactly where the stem cells need to be released to start doing their job. You get the ultrasound guided injection in the different areas that you need, and then you leave with the Band-Aid. There's no downtime. Now, there's minimal side effects. I'll tell you, everyone we ever heard. You might be a little stiff, right? Because there's a healing process going on. So you might be stiff or sore for even up to maybe 14 days. But chances are you're not, especially if any type of active life right now. There might be bleeding or some bruising at the site, especially if you're taking some type of blood thinner right now that you're doing. There'll be no drugs used whatsoever. You're wide awake for everything. There's no major operations at all. A lot of these surgeons, you go to an orthopedic surgeon, you have to sign something saying that what? You may not be waking up. All right, and 50%, more than 50% of those surgeries fail. There's no surgery. There's no 6 to 18 month rehab. And this addresses the actual condition. So I don't want you to think that this is a healthier, safer alternative to a drug. Well, it's not a steroid shot. It's not a drug. It's not an opioid. It's not, no. This is not replacing some type of modality that just masks the symptom when your problem's still there. This is actually getting to the root cause of the problem. It's addressing the actual condition. It's the only thing you have done that addresses the actual condition. Exercise doesn't address the condition. This is actually regenerating the lost tissue. And for many of you, it's going to be a simple one-time injection, a one-and-done procedure for many of you, one and done. Now, no one ever told you this, but last time you went to your doctor, I don't think anybody actually set you down and they distilled the information to tell you why you're feeling this pain. So what is joint pain caused from? And I'll tell you why they don't tell you. You know why? Because they have nothing to help you with the cause. Now, on the far left, you're going to see a knee. The far left, it looks like a handlebar mustache in between the knee, right? See that black spacing in there? That's cartilage in the knee. Now, right to the right side of that knee, you're going to see a degenerative knee. What do you see? It lost the cartilage, it lost the tissue. Now, when your joint loses cartilage, it doesn't lose it symmetrically. It loses it asymmetrically. So now the joint shears, it's out of alignment, and it grinds like a pepper grinder. So each day that goes on, your degeneration is logarithmically getting worse and worse. This is not something you wait on. So you can see right there, there's bone on bone, but there's still little bits amounts of tissue in there that can be regenerated. So you can see right there, lost tissue. The hip. You see that's a ball and socket. It should be a lot of hip. I'll use my little arrow here. Do I have the, there it is. There should be a lot of tissue around that hip. Now look at this degenerated hip. There's no tissue whatsoever, maybe a little bit left in there. It's totally degenerated. So very basically, why are you having pain? The only reason why you're watching this, the only reason why your life is being affected, you're having pain, one answer, you lost tissue, right? You lost cartilage, you lost some type of tissue. If you have neuropathy, you lost nerve, capillaries. Like, there's some type of tissue that's been lost. Now, the reason why they never tell you that is because if you restore the tissue, then you heal. So we got to make sure that we don't do anything from this day forward that destroys tissue or destroys it or doesn't do anything to help you what? Regain tissue. Because in the typical insurance model, what do you have here? Medications, NSAID, and opioids. Do they restore tissue? No. cortisone shots, steroid shots, opioid injections. They might buy you time, take you out of pain, but do they restore tissue? No. Then if we cut out your joint, well, there's no tissue to be restored. Now it's looking at massive surgery. So they actually did a study comparing surgery and stem cells. Berkeley Bedell, an Iowa congressman, they took, before they brought regenerative medicine into Iowa, they took two groups of people, 223 people each. They compared the average cost of knee surgery was $70,000. The average cost using stem cells was $15,000 to $17,000 for both knees, no surgery required. Now, the surgery patients, on average, 23 will suffer serious surgical complications. Do you want to take that risk? Stem cell group, no significant complications. What were the complications with the surgery group? 1 to 2 will die, 1 to 2 get pulmonary embolism, 1 to 2 suffer heart attack, 11 to 14 will require readmission for serious infection. But here's the thing, some insurance coverage. So the reason why a lot of people go that route is because, well, my insurance may pay for some of it. Well, okay, they may pay for some of it. You're still paying for some, but now, I mean, would you take the risk of dying, having a pulmonary embolism, heart attack, it not working, or being, admission for serious infection? I mean, you can't, you wouldn't. You wouldn't say so, because I'll tell you right now, COVID has a 99.345 survival rate, but yet look how the entire world shut down. So right here, this is, I mean, you have way more risk going that surgical route. But now when we go to the stem cell study, no significant complications. Watch this. 90% of patients had greater than a 50% improvement. How many of you watching this right now would love to be 50% better? 50% of those people had over 75% relief. And right here, the bone marrow aspiration or the Wharton's jelly, the umbilical cord tissue, is not covered by your insurance. It is not covered. Someone asks, well, I don't get it. It's cheaper, yes. No insurance, it's cheaper. No surgery is needed, yes. 90% had improvement greater than surgery, yes. And none of these people died in some of these problems. Yes, I understand that. So how come my insurance doesn't pay for it? Because it's not a drug and it's not a surgery and it can't be patented. We're using natural occurring tissue from your body. We're using natural occurring tissue. They can't patent that, right? So insurance will not pay for that. Now, we do have other regenerative techniques and systems in the office that your insurance or Medicare may or may not pay for. But again, they will not give you the type of regeneration that we're talking about right now, what I'm educating you on. But they will buy you time, and yes, they could get you out of pain, but we're looking for the body to be able to heal itself. So there are those areas that they may pay for, but not what we're talking about that will give you kind of the best amount of care that you're looking for to get you well. So just to show you the using the bone marrow from using the stem cells from your bone marrow, right, alongside the umbilical cord tissue, you can see right there on the left, that's a torn cartilage. You can see it looks like torn clothes. Within 12 weeks, look how it totally healed right there, right there. Again, no drugs, no surgery, your body able to heal itself with the right properties. Now, they also did a study showing there will be a 75% increase in cartilage thickness at 5 months. In 5 months, if you increase 75%, what would that mean for you and your pain? You'll be so much better. Now, just to show you, if a lot of times someone says, what are you going to guarantee me? Well, the first question we will ask you is, would you ever tell your medical doctor that, or your surgeon that, can you guarantee me this will work 100%? What would they tell you? Not in your life. You got a 50% chance or worse. They don't even guarantee that you'll wake up. So if anybody tells you, or if you're looking for a 100% guarantee, or anybody's giving you a 100% guarantee, it's an impossible thing. It never happened. Run. All right. And we will run too if someone wants a 100% guarantee from us. So what we do is we don't have a 100% guarantee. We wish and we want that empathetically for everybody. We want to see everybody win and get better. But using the studies right here, we have a 92% success rate. That means at the 3-month mark, 92% had either a 50% or higher improvement at the 3-month mark. That's 92%. So the results of getting your body to heal are tremendous. Again, without all the risks that we just went over with surgeries, drugs, and insurance-driven care. So this one's very close to me. If you're sitting here with back pain, what is back pain caused from? It's, again, loss of tissue. Now, on the right, you'll see in your spine, you have those bones, and in between the bones, you have nice, thick discs or tissue. Now, between that L5, S1, you could see right there, look at the tissue above L5. It's thick, 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 and that's the hole where the nerve root comes out of. But now what happened between L5 and S1, what happened to that disc? it's gone, it's degenerated. And what happens when that goes down, it crushes the nerve that's coming out of that hole. Now, this is what I was dealing with in my back, right? I'm on my feet, I work out, I'm very active, taking care of patients. This affected me as well. So what were my options? My options were I could do surgery, right? I could do a spinal fusion, or I could do a laminectomy, or I could take drugs and mask it. Now, all these things, where would that end you up? Sickness, disease, more surgeries. So I personally opted for the bone marrow and the bone marrow, and then alongside that umbilical cord graft to get the younger, more powerful cells in there as well to supercharge it. And within 5 months, you could see on the left before, the disc material was pushing into my spinal cord. So you could see, looks like a white lake right there with a dent in it. That's your spinal cord. Is that important? Absolutely. Your spinal cord is your lifeline. It carries the only thing that carries life from your brain to keep you alive. Now, on the right, 5 months later, look, the disc entirely healed, no pressure on the spinal cord. Would that be valuable to you with no drugs and no surgery? Absolutely. Was it valuable to me? Incredible. I'm doing things now in my 40s that I would never be able to do even in my 20s. So imagine your life pain-free right now. Remember, we went over that. Is it possible to live a life? Were you able to live a life of possibility and living life on your terms without pain? Yes, it's possible. Now, if you're a candidate, now going through this, now is it capable? If you're a candidate, that your body could heal and become pain-free once again? Yes. Are you able to get that opportunity back in your life? Yes. Now, the third question, though, is are you worthy of it, right? Because that really comes up to you. Because if you do something about it, you could change your future. You could create a new reality. But we know if you don't do something about it, what's going to happen? The problem's going to get worse. You really have three options. You could go the drug route, right? Do you want that, or why do you want to be here? Do you want surgery? No. Or number three, you do something about it. You get that opportunity back, but the choice is yours. If you feel worthy enough and you understand that time is your greatest commodity, and then you invest in your health and you actually change the equation. See, everything that you may have been doing or not been doing up until this point has gotten you to this point, right? So if we could change that equation, we could start getting to the root cause of the problem, getting your body to start healing itself with its very own healing factors that were used to heal you in the first place and create those cells and tissues. You will absolutely create a new reality from this point forward. So you're about to enter into our consultation, and our consultation will consist of this. You'll meet with our doctor or a doctor and or case manager, for at least 30 to 60 minutes. They'll do a complete medical history with you. They'll do a review of systems. If you brought your MRI, CT, or x-rays, they will absolutely do a courtesy review with you, the doctor, and the lab as well. They'll review that. But we're also going to do, or you already had, digital stress x-rays done. Very important. Again, it's all about the difference. Again, what is the difference? It's not only using bone marrow from your body, but we're also, not kind of on the side of it, but separately, we're also using those more powerful umbilical cord tissue. That's a huge difference right there to get you the results you need. That's very powerful. Then we're doing these digital stress x-rays. This is where you were sitting down, or we're actually taking pictures of your joints. That's weight bearing. Why? It tests your joints under stress. If you're laying down, there's no stress on your spine or joints. It's inaccurate. And then because it's inaccurate, they're going to miss things. So we're able to see things that other systems had failed to see. And then if we could see things that other systems failed to see, we're able to get you results where other systems have failed to get you. It's 100% better than a static x-ray when you're weight bearing, and there's less radiation than static x-ray due to its digital component. So you're about to get $1,500 worth of examinations and testing right now in the clinic. But before we do that, this is what we're going to go over a couple things. We always tell you to bring the person closest to you. So right now, if you're watching this and you have a spouse, a significant other, a fiance, or a partner, then they would be with you here right now with you. And we appreciate that. You know why? Because we found out, we always find out extra information that we normally would not have found if that person wasn't there with you. Plus, they're there with you because both of you must understand what will happen if this problem goes uncorrected, the continuation of sickness and the disease process that will happen. Plus, you'll understand all the information. You have to see the exam findings, see what's going on. So then you both understand. So now you're educated. You have all the information you need to make a very educated and logical decision to understand what will go forward to be able to get that body to heal the way you're supposed to as well. Now, when it comes to the prices, people, what's the prices? Here are the prices. Normally, if you just walked into the office, one area of the bone marrow and the umbilical cord tissue, one area will be $7,880. So what is one area? That's like, say you did your left knee, or you did your right shoulder, or you did one area of the spine. That would be one area. Or if you did two areas, let's say both knees, both shoulders, both feet, that would be 12,997. So you can see when you get two areas, the more you get, the less the price gets. Now, because you're watching this today and you're here today and you're educated with this now, we're able to pass on to you a seminar discount from watching this. The reason why you're able to pass it on, you allow us to order the products in volume. So the more we could order in volume, the less the cost per unit is, and we just pass that cost 100% over to you. So because you're here today, your seminar discount goes down to this. The gift for attending, one area is 68, two areas is 10.8. So look at the savings. So you're going to save today, you would save 1,080 if you got one area, or you're going to save $2,197 if you got two. Now you're saying, well, doc, you'll tell the doc case manager, I needed all these areas. Well, it's just four for each additional area you get as well. So they will determine which ones you're capable of getting, which you're a candidate for, if it could be accepted to do or not, and then you'll be able to determine which areas will be effective and right for you. Well, thank you so much for watching this. If you have any questions, just let your case manager know. Again, it's about living life on your terms. We're here for you. We hate to see you just living the way you are, knowing that you could be better and reach that potential. You're here to live an abundant life. You're here to get your health back. When you have your health back, you could do anything in the world. But I'll tell you, when you don't have your health and you're in pain and you're going through a lot of trouble because of painful issues, you only have one wish. And what is that? To get your health back. It's all about quality of life, right? Time is our greatest commodity, and to have a quality of life, you need to have time and you need to have your health combined together. And right there, if you're accepted and you are a candidate, you're going to be able to open that doorway to walk in and get your body healing again by getting to the cause of the problem, using your body's own healing mechanisms to get well. So any questions, let your case manager know, and we'll see you soon. Bye-bye.